My title is Small RNA Fragments Support White Blood Cell and Platelet Proliferation in Cancer Patients Undergoing Chemotherapy. I think here's actually my title, and as you just heard, I'm Director of Research at Natural Source International. It's a small company located in New York City, and most of the work that we do is based on scientific research conducted by a scientist named Mirko Beljanski at the Pasteur Institute. He worked there over the 70s, 80s, and he died in 1998. He was very much a pioneer in terms of environmental medicine. He's developed some products, plant extracts with anti-cancer effects, which I've spoken about here before and which are really remarkable. But he's also did some work on small RNA fragments and demonstrated very clearly that they have a chemoprotectant effect. So the take-home for this talk up front is I'm presenting a natural product, it's RNA fragments, that address a critical problem in support of immune system response. These fragments can actually prevent chemotherapy-induced thrombocytopenia. They work, and they don't have negative side effects. Well, the agent then is these RNA fragments. They're specially prepared. They're actually relatively small fragments, but they are treated in such a way as to be completely purified of any other DNA or protein or lipid. And they exist in the preparation in a range. It's not all one size. I'm going to describe the results of a clinical trial conducted at Cancer Research Centers of America, but I want to talk a little bit more about the agent and about how we set up the trial. Actually is the complex Midwestern Regional Medical Center out in Zion, Illinois. And we were lucky enough to work with a group headed by Dr. Robert Levin in association with Dr. James Grudge, who were interested in trying something alternative. RNA is now a very mainstream subject and topic of interest in biomedical research, and small RNAs in particular have really come into their own. And here again, Beljanski was ahead of his time, but because of the problems I'll describe in terms of the effects of chemotherapy on the immune response, on bone marrow, the group at Zion was interested in doing this trial because there's really nothing that helps CIT or chemotherapy-induced thrombocytopenia. Well, contemporary anti-cancer chemotherapy, many of the drugs in use are myelosuppressive. They damage the bone marrow cells populations, including the stem cells. Today, the suppression of platelets, this is a condition called thrombocytopenia, is a common treatment-related side effect of anti-neoplastic therapies. And in fact, if you talk to the oncologists who use these drugs with their patients, they'll tell you it's ultimately now the rate-limiting problem. And it's the inducement of the induction of thrombocytopenia by some of these drugs that completely derails the treatment program that the oncologist is trying to accomplish in terms of shrinking the patient's tumor. Well, one of the critical components produced by, ultimately, stimulation of stem cells in the bone marrow are platelets. And platelets are small structures. They have a normal range, of course, of 150 to 400,000. Low levels lead to increased bleeding risks. So what platelets are essential for is clotting to prevent hemorrhaging. And it's virtually impossible to live normally or live at all without an adequate number of platelets. So what are the signs? You can imagine bleeding or bruising very easily. And for someone who's has grade 4, a severe case of thrombocytopenia, walking across the room and bumping into the edge of a table is a life-threatening event. Their activities are severely curtailed, and they always have to be alert to even not a superficial cut necessarily, bleeding would occur outside, but internal hemorrhaging as well. But nosebleeds, blood in the urine, which would be internal, bleeding in the gums or mouth, and petechiae are also early signs of thrombocytopenia. What are the consequences? Well, decreased quality of life, as I just mentioned, limitations on physical function, the requirement in the context of chemotherapy for platelet transfusions, Fatigue is another component. But what the oncologists will tell you, that they compromise, as I alluded to a moment ago, the treatment and force changes in the protocols or the regimens for chemotherapy, and ultimately limits its effectiveness. So what happens? Interferes with the timely administration of anti-neoplastic therapy, and as you'll see in the slides I'm going to show you, when the platelets decline to a critical level, the oncologist has a choice of either interrupting the treatment for some time altogether or lowering the dose of the drugs so that the effect on the platelets is not quite as dramatic. Thrombocytopenia in these patient populations is associated with shorter patient survival, significantly increases the utilization of medical resources. These patients need a lot more attention, and it's costly. And obviously, the quality of life issue is major. Well, there is then, I hope I've convinced you, and any oncologist will know already, there's a need, there's a real opening for a medical treatment to prevent thrombocytopenia caused by these oncology chemotherapeutic regimens.